afternoon, everyone. Thank you so much for coming. I think we're having a larger audience every time we do this, and it's so good to see everyone. So this is our third show this year so far, third of 5 total. And we are pleased to welcome our artists who are, Ted is going to introduce them to you, but this is the GI art show, and the first year students are studying the GI system right now, and that's why we are having this show that aligns with our core curriculum and gives us a view into the patient perspective of illness as rendered by 2 really stunning artists. And I'm also really excited to welcome Dr. Ippoliti, who is you are the Associate Chief of GI Liver Service. Is that at Keck or USC or all of the above? LA County? Keck, okay. And so he brings a physician perspective, and I am thrilled now to turn over to Ted, who will take it from there.
Okay. Thanks everyone for coming. This is great to have so many people here. So these are our artists, Sydney, Snyder, and Daniel. I've always said it's Leighton, but it's actually Leighton, Daniel Leighton. So they both do work about GI issues, but they have a very different outlook on it, and we're going to get into that in a second. But first, as I always do when we pick these, I grabbed a couple facts. So let's see how smart you guys are. How many cases of acute digestive disease are treated in this country every year? Anybody have a? It's got to be a guess in here somewhere. 14 million. 14 million. How much do you think we spend on GI issues every year?
Toilet paper alone's got to be in the billions.
$17 billion. And the total economic effect between lost days of work, things like that, $50 billion. And then the final question, which do you think causes more GI problems, Domino's or Little Caesars? Okay, that's my joke, right? All right, doctor. With all the exciting medical specialties, how did you decide that this was going to be your specialty? How did you get into intestinal
How did I get into
disease?
GI disease? It was a medical school thing, and I think that when you're in school, you find that a field that just kind of captures your interest a little bit more. I mean, I had a lot of medical school classmates who said that every time they went on a new rotation, it was exciting and it was interesting. Yeah, not so much for me. When I went into gastroenterology, there were a lot of things that we do now that were unheard of then. So I've actually had a chance to watch the field evolve, and fortunately for me, it's evolved in a very positive way.
All right. You're at a cocktail party, someone says, "What's your specialty?" You say GI, and their reaction usually is?
Usually I say I drive a truck, and because, everybody in the United States has gas.
Yeah. All right, so we're going to go back and forth between medical and art questions here. So we're going to go to Sydney. So you call your work poo-dazzle.
Poo-jazzle.
Poo-jazzle. So you do these beautiful glitter, happy paintings about poo. So how does one keep that poo-jazzle attitude in a life with a constant GI issue going on?
So I have celiac disease now, so I still have some GI stuff that I'll always have going on. But I started this work after I battled with C. diff for around 9 months. And that was like a really dark, lonely period, and I felt like I couldn't talk to anyone about what was going on. When I had to take off from work, it was met with like kind of skepticism because I wouldn't say what was going on with me because I didn't want to say, well, I actually already had diarrhea 30 times this morning and it's 8 a.m. so I'm not coming in today. So once, like the thing that got me through that period was making jokes with family and friends. Everything became like a poophemism, like, God, I'm so sick of this shit. And it was like, oh, wait, yeah, no, I really am. So after that, after I spent some time recovering, I had an FMT, and that treated me. And I'm guessing everyone here knows what that is, a fecal microbiota transplant. And that
Think
worked.
of that while you're eating lunch.
And that was after 4 failed rounds of antibiotics. So that worked, and I had a whole new perspective on poop after that. And I now view it as like just, I know it's one of the most information-rich substances on the planet. So that's kind of how I came up with the glitter. And it also, glitter's just like fun, and I think people might be more willing to talk about or look at poop if it's made of glitter. So, yeah. So it's, my goal is to reduce the stigma around GI illness and make it something that people can take the stink off GI illness.
There's so many jokes. It writes itself.
Right? Yeah. So that's how. And I also just don't want people to feel as lonely as I felt. So just kind of like starting a dialogue and yeah.
Okay. Now, Daniel, your work is sort of totally opposite. Yours is really serious. You've got people opening up their stomach, people throwing up in front of the toilet. But my interaction with you over the years, you are nothing but charming and upbeat. So how does that land up in your artwork? How do these images?
I guess it's because, like, this is what I've felt my whole life. But yeah, most of my artistic output until maybe 10 years ago was, or maybe further back, but was more comedy and all that. But this was like the place that I could put it, because when you talk about this stuff to people, first of all, I find it hard to even describe, or articulate what I've experienced. And secondly, it's just, it's often too much for people. And that's part of, my colors, and actually there's similarities even in what Sydney was saying about making the pieces appealing, even though it's a dark subject,
It's just very funny because you laugh, yours matches you outwardly, whereas yours doesn't seem to match you outwardly. So I'm wondering if, you project this. A lot of people that are ill have to sort of project the healthier person outside because people will get sick of hearing them complain about being sick.
Yeah, for sure. I was born with it too, so I also there's definitely what you just said, but there's also the aspect of just finding a way to get through life and trying to make the best. Basically, I just try to adapt to whatever is functioning at the time, because I've had my colon removed and I have an ileostomy, and I could go on and on with my history, and still I'm in pain every day. And so I just had to either find a way to adjust or to stay in bed and be miserable, So, and also I think it helps that when my parents, I was brought up not really thinking of myself as a sick person. So, I don't know, it's a part of me. Humor is like an acceptable way to be out there, but this stuff is a little heavy to be talking to people about generally, and yeah.
That's what's so interesting when you both you guys, you put it in the galleries and you hear people laughing, joking, let's talk about poop. Like, look how many people are here to talk about poop today. It's great. So, doctor, when people come to you and they've got some distress, I would assume as an outsider, people might wait a little bit because like she was saying, there's a little embarrassment factor with this, so they might get to you a little later than they should. So for these guys, what should they be looking for early on when people first come, and how can you sort of ease people into the fact that they might have these problems and they're going to have to deal with them and talk about them?
So, it's a chronic disease, so you look for things that fit that chronicity. And so something like diarrhea, for example, that's going to happen on a large proportion of the time that once this patient becomes ill. So, you know, you look for those kinds of things. Some things are a little bit more episodic, but they tend to be a little bit more violent, like obstructions with vomiting. But, you know, sometimes the things are very subtle. You know, your GI tract has a very limited ways of reacting to the world. So things like abdominal pain or changes in bowel habits, there's so many different conditions that can produce that. And you don't, you know, every patient that you see, you don't want to put them through an exhaustive workup. But you can do some small things which can provide clues. So laboratory work can be very helpful in terms of looking for things like anemia or testing to see if the patient has some inflammatory markers in their blood.
I think it's something where there's so many options to it as far as what treatments can be, different illnesses. So they must be a little nervous coming to you.
Yeah. I mean, once you've made a diagnosis or you see a patient with a diagnosis, I think the most important thing that you can do is to explain to them that these things operate in a spectrum. And so what they may learn on the internet or what they may learn by going to chat rooms, still call them chat rooms, is not necessarily how the disease is going to be for them. And the day that you're seeing the patient, you're going to prescribe X, but in the back of your mind, you know what you're going to do next when X doesn't work. Because we have, as you point out, we have a lot of different ways that the disease can be treated, a lot of different medications, a lot of different tests that we can do. So you have to be thinking very proactively when taking care of patients with inflammatory bowel disease. That's, you know, that's a paradigm shift. So when I got started doing gastroenterology, the way you took care of patients with IBD was totally reactive. You told the patient, if you're fine, don't come and see me. Just come and see me when you have a problem. Way too late in the game for that. So now we know how to change the natural history, how to modify things, how to keep patients out of the operating room. And you have to employ those things early on to make them successful.
Can I say something?
Yeah.
So speaking of the proactive approach and thinking ahead, I know I spent as a patient a lot of time in the dark, and that made me feel so scared, like everything was presented like this is the option, and if this doesn't work, I felt like, you know, then that's it. So now I have some doctors that I love and have a really good relationship with, and I found something that helps me personally, and I know every patient is different. It's kind of knowing those next steps. And oftentimes with me, it like hasn't had to get there, but then I don't like spin ahead into the future thinking like, well, this is it, this is the only option. And that like mentally has helped me so much. So I think that's definitely something you can share with the patients if.
Yeah, no, I completely agree with you. You always have to provide them what's the alternative going to be. And you know, so we're always working toward that best possible outcome, and the door's never shut to that.
Any thoughts on this?
No, I mean, I agree with Sydney. It can be scary. I mean, even knowing the next options, you know, right now I'm taking 6-MP mercaptopurine. So, and I was recently looking at having to go up to a biologic like Remicade, which was, from my perspective, it's probably different for people who are, I would imagine, who are newer to the disease, but from my perspective, it brought up a lot of fear, knowing that might be the next step. But I think similar to Sydney, it's better to know that there is a next step. But the fear for me had to do with PTSD and all the stuff I went through very early on, and thinking, oh no, I'm going back down that road. You know, with the, it's also the side effects are pretty scary, you know.
You got great hair.
Exactly. Yeah.
So this fecal transplant. Mm-hmm. So when there's nothing to it, right? How did that work for you? How long did it take? Was it successful? And what did you think when they said, we're going to give you some poop pills?
So I didn't do pills. What the progression of things was that I started with symptoms like in July of 2000, 12 and didn't get a diagnosis of C. diff on paper until March of 2013. So, and then my FMT was in the end of November of 2013. So this was like a long process, and I was miserable. I couldn't get an answer from anyone as to what was going on. And I had a friend in medical school who was in her GI unit at the time, and she told me about fecal transplants, and I like mind blown. We were Googling everything. It was so funny. And, you know, I wasn't thinking of that as a real possibility. I just thought that that was so crazy if that was happening. After the 4 failed rounds of antibiotics, like it was, you know, Flagyl and then vancomycin and Difficid, I think was one of them, just like over and over again. I felt very optimistic about getting an FMT. I did more research, and then it was a problem of finding someone that actually did it. So I was living in New Mexico at the time. I had actually moved there because I was hoping the red dirt and crystals and voodoo would heal me. I learned, and I have a post up there about that, I learned that that's not how C. diff works. But I flew to Los Angeles, and I met with a couple different doctors here, and it was basically like who could do it the soonest. And my difficulty was that I have celiac disease, so there wasn't enough research at the time, and I'm not sure if there is now, to know if the transplant is coming from someone who eats gluten, if that would have an effect on me that would kind of like negate the positive effects. So we couldn't do pills, and we couldn't go to like the stool banks that were available, so I had to send all of my friends and family a list to see if they met the criteria, because it's like you can't have had a tattoo in the past couple of years, and just a really long list. And all my friends were really like positive and cool about it, and I had 2 friends go through testing. They both had to go get a bunch of blood work done, and then one of them, they both were fine, so then one of them had to, in the morning, like eat a bunch of broccoli and coffee, and my husband, who's a saint, went and picked up the sample in a little cooler, and I went to the surgery center, and then that morning had it done. And then there's a really distinct smell with C. diff. Like they actually are training dogs to detect it in stool. That's how distinct it is. So I knew right away. I mean, they don't want you to poop for a few days because it has to do its thing. So I knew right away that it had worked. And then when I went back to New Mexico, it actually came back, and I could tell because of the smell. And then by the next day, it was gone. So, and then I've not had it come back since.
So you were saying you've been doing this for a long time. So even as a layperson, I read about all new research, gut bacteria, poop thing. How do you keep up on all this? How often do you have to go to refreshers, read new journals? How do you keep up on what's going on?
You try to get a job in a university where there's a lot of bright young people around who tell you all this stuff.
Anybody applying? So you guys, you both do a lot of stuff on social media with your work. So have you guys built, is there a community out there on social media through your art that you're giving support to and getting information out? Why don't you talk about it first, and then you?
Sure. Yeah, definitely. I get lots of messages and comments and stuff from people who have been through this, and you know, part of what I'm doing is trying to depict a feeling, so that someone can look at that and say, "Oh, this is what I experienced too." When I grew up, I didn't really have a way to communicate with people what I was going through. So now I find people are writing to me all the time, "Oh my God, you captured exactly, you know, what I felt." And there's sort of an instant bond that forms because we've both been through that. And even, you know, just sort of beyond that, I look at the illness, all the stuff I've been through as a pathway inward to the deepest parts of myself. And I feel like I can capture emotional states that we all feel and that we rarely express. And so I think these, beyond just the GI stuff, they capture something human.
Yeah, I have definitely found that there's a community on Instagram in particular. I had never been on Instagram before I started this project in 2014. And I realized pretty quickly that no one was talking about C. diff. So hashtagging something C. diff, there were a handful of people that may be looking at that, but those people reached out with such a sense of desperation that was so familiar to me, but what should I do? And I don't know how many times the first couple of years I was running this, I had to say, I'm not a doctor, I'm not in a position to give you medical advice, but I can tell you what my experience was, because so many people with C. diff suffer for so long before it's just so aggressive now and antibiotic resistant. But there's definitely people out there who, just knowing there were other people who had had an FMT or who had gone through a bunch of failed antibiotic rounds, that was a comfort to them, and I know it would have been to me. So that's kind of a cool function of social media with illness and art.
So we'll put you out of your safe zone now. So look at the art. What's your thought on the art and the two different perspectives we have of these illnesses?
Yeah. Well, actually, I think they're very fascinating. So I'm looking over here. So there's a thing called the Bristol Stool Scale.
I'm very familiar.
Okay. So you could do a whole panel for each one of those items.
Yeah, my issue is I think there needs to be a big time addendum to it, because I don't think it covers enough. So mine would be much more expansive, but that's a great idea.
So I was going to ask you about this picture. Is this you want to rip your guts out? Is that the concept?
Well, no. I mean, it's called Opening Up, and it's really about finding, taking your wound. That's really where my scar is. I had 6 operations in that general area, and it's about finding your wound, identifying your wound, and finding the treasure, the gold, the blessing, that sort of thing in it. It's also about at this point in my life, I was revisiting. So this is this painting I did in 2011. My last abdominal surgery was in 1991. So this is 20 years later. And almost to the date, actually. And so part of it was that I'm opening myself up this time. So whereas before, when I was, from 11 to 21, I had my 6 surgeries. So I didn't have a lot of, I had choice, sort of, but not really. So this was me taking control, opening myself up, revealing this part of me. Another thing about it, as Ted mentioned, it's an invisible illness, obviously, and so all of these are kind of a way of me saying this is who I am, because so much of my life I had to keep it undercover, and it's not, it's not something that's a comfortable thing to talk about or any of that. So I wanted to bring some comfort to that.
Yeah, there's a story associated with a screenwriter. Anybody here know
Dan O'Bannon?
Dan O'Bannon?
Uh-huh.
Dan O'Bannon's story. Dan O'Bannon wrote Alien. Dan O'Bannon had Crohn's disease, and he had fistulas.
Yeah.
Okay, so a fistula is an opening between your bowel and your abdominal wall, which is where the idea came from. This is not a HIPAA violation. He's actually discussed this in a couple of interviews, and actually he's not with us anymore. But so it's kind of interesting, I think, in very talented people, very creative people who can take this kind of a process and not make it interfere with their ability to do what they can do creatively, maybe even stimulate it to a degree.
Yeah.
So,
Can I add one thing?
finish, because you had told me the same story. So the scene in Aliens where the alien pops out of the guy's stomach, that's from the Crohn's disease.
Yeah. Oh, I just wanted to say, there's also these 2 pieces, the first 2. The first one's called Tied Up at the Hospital, and that was about an incident where I was taken into a room, and they were putting an NG tube into me, and I was like 5 years old, and I was fighting them off, and no one really explained anything to me. They just tied me up, taped me down, and that's like my emotions leaving my body. And so part of, like, these two pieces were the first and the last piece in my first solo show. And it was like kind of the journey from being tied up, feeling powerless, to then taking back power in this other piece here.
So Sydney, last thing before, then we'll open it up to you guys for some questions. So you're a teacher, and I've seen your students give you little poop drawings with rainbows on them. And so how do you discuss it with your students?
When I first started working at the school, I told students kind of vaguely, like, I made art about illness and my experiences with illness. I had a couple students that, like, were more interested, and I expanded a little bit. And then my middle school students I felt comfortable sharing more details with. But now at the school, because when I first started working there, these few students knew and would give me like a little poop emoji stuffed animal and like a mug and make me all these drawings, and kids are just into poop emojis now. I have students who have like rainbow poop emojis on their backpacks, which is pretty funny. Water bottles, lunch boxes. So my classroom has stuff all over. Like, one kid got me a little painting. So parents, teachers, people looking at the school walk in like, what are all the poop emojis doing? So then they see, and more kids start bringing stuff. So.
Does anybody have any questions for the doctor or the artist, or comments about the art? Hold on. I get to run around and be a host.
Daniel, I wanted to ask you this this painting where he's opening himself up. He reminds me sort of a Batman or of a comic book figure. Was that intentional, and what were your thoughts on that?
Yeah, I think so. It was sort of, you know, Joseph Campbell's very, has influenced me a great deal. I don't know, I think you know who he is, it seems like, but The Hero's Journey, very well worth looking up. Basically, he studied all sorts of cultures, religions, philosophies, and found commonalities of the journey we take when trying to overcome something. So, and I've always grew up loving Superman, Batman, and all that.
So your story about the NG tube, or feeding, was it a feeding tube?
I don't, you know, I'm not totally sure. I'm guessing it was one of those two. Okay. Yeah.
I recently was at our Association of American Medical Colleges meeting in Boston, and one of the plenary speakers was Don Berwick, he's actually a pediatrician, but he's the former head of Medicare and Medicaid services, and now he's head of a Institute for Healthcare Improvement, Quality Improvement. And he told stories, his whole talk was stories about patient empowerment, really, and the ways in which patients taking charge of certain things can change the whole shape of healthcare, including lowering costs and improving outcomes. And he had, part of his talk was a video of a little boy. This little kid had made a YouTube video to teach other children with Crohn's disease how to insert their own feeding tube.
Oh, wow.
Because he had to do it every night. So I'd encourage you and any of our students who want to look it up. It was just adorable. He was just, I think he was 9 years old. It was great. So.
Wow, that's awesome.
I'm here because my daughter suffers from abdominal issues from birth. And you just mentioned patient empowerment. And it's frustrating because you go to a doctor, a gastroenterologist, and they almost like make it seem like, oh, she'll grow out of it, you take this. And then you get so discouraged because nothing works. You go to another doctor and it's the same thing. And when she was younger, she said that she wanted to study gastroenterology because it seems that the gastroenterologists, because they haven't experienced it personally, they're somewhat detached and she can't identify. So I want to encourage all of you who are studying to really, try to understand, get on a more personal level to really, to encourage them, because my daughter's so discouraged, and we're trying to continue to find ways Because we'll ask our GI, okay, well, what about this? What about that? What about this procedure? No, you're too young. You're too young. And she's tired of taking the medications because of all the side effects. You know, you mentioned the number of people miss work. She has missed school. I don't even remember how many times she's missed school. She's in high school from kinder through now. She's missing school today because of this, hoping that we can get some insight on how to proceed. So I want to thank you for sharing your stories, because yeah, it's dark when you don't know who to go to, when no one around you is experiencing it. So I want to thank you and encourage all the students to maybe try to get on the patient's side and be able to provide help that way.
Yeah, and I just want to add, I relate to that very much. For on what you said, I mean, I think just being present with the patient is incredibly powerful. And you know, we changed. This was when I was 5 years old. That one at the end, and we changed doctors after that. And the doctor I went to after that spent a lot of time with me, explained everything that was about to happen before it happened, which was a requirement for me. And it made a huge difference. My current doctor, who was actually the partner, he's interested in what's going on with me emotionally, which is extremely important. Emotions play a huge factor in this, just in terms of exacerbating it. And it's just for all of you that are students, if you ignore that data, you're missing a huge piece of the puzzle, you know. So I don't know what it's like now, and I imagine it just varies individual to individual, but I think I encourage all of you to really take that in for your patients, and you know, and for you guys, if you're not satisfied with the care you're getting, you know, keep looking. I know it's tough. It's really tough, because when you're sick and you're trying to figure this out, and you're the mom, and you're under all kinds of pressure with this and having all sorts of feelings about it, and you're worried about what your life is going to be like, you know, it's overwhelming, you know. So, but I'll tell you that I was in a really, really bad place, and you know, I'm not saying life's easy now at all, but I'm doing things now that I didn't think I'd be capable of doing when I was your age, I think. I don't know how old you are, but you know, when I was, from my whole life basically until I was 20 or something, you know, I never knew how I'd even have a job or anything, because I didn't know how I'd do it. So even in the worst cases, it can and usually will get better, you know, so keep looking.
So, doctor, do they just keep doctor shopping? How do they make sure that she comes to you, she's been to a couple different people, still not getting anything, and knowing that maybe nothing's going to work?
Well, I think there's sort of two families here. One is the family of an undiagnosed condition, and the other is you have a diagnosis, you're not really sure you're seeing the right people. So in the world of inflammatory bowel disease, it's really important that you have a relationship with a person who feels like that they specialize in inflammatory bowel disease. You can find those people mostly in academic places. I came from Cedars before I came here, and there's a large center in IBD at Cedars, so there were at the time about 8 doctors who specialized in inflammatory bowel disease. So if you came and saw one of them, you knew you were going to get the right facts. You might not have gotten the right degree of empathy. I mean, that's a variable, and not everybody's really good at it. I mean, that's not something that medicine teaches you. That's something you bring to medicine. And so it, you know, so there's a large variation in the world of practitioners in terms of how much they ask you questions that are beyond does your belly hurt. But you know, I think to get get back to your original question, is it's very hard to take care of a chronic condition if you do not have confidence in your practitioner. So it is very important to find somebody you have some confidence in.
And I would add that I didn't know that it was a possibility to, if you didn't get along with your doctor or didn't trust your doctor, to go find a new provider, and just going through illness is what just helped me be more assertive and take charge. And I now, like, if I have a doctor that I really like, and it's not my GI, I have a GI that I really like now, I'll ask them, like, do you know anyone that you would recommend based on, you know, our relationship or my temperament? And that's how I've found, like, all of my doctors now, and that's been really helpful. Because I would much rather have someone sit down with me and just ask me everything and build that relationship with me than spend 15 minutes with me, even if they know more than the other doctor, you know?
Hello. I was curious about access to care, because I know you mentioned, like, you work at Cedars and we're here at USC, but if you're battling a chronic disease related to GI, how is that affected by insurance, or how costly is this disease for you?
Well, there are two kinds of insurance, and there's a PPO insurance and there's an HMO insurance. So if you have a PPO insurance, you can go see any doctor anywhere. Your insurance is likely going to cover that. If you're in an HMO, you're going to need an authorization from someone to see another physician. But generally, you can get those. If you have a complex problem, most of the time, your doctor taking care of you in the HMO is going to be more than happy to authorize having you see somebody outside of their network, just for the added support and information. So you can definitely move around within your insurance plan, and most insurances that have lists of doctors that have signed up for it have a fairly long list. Now, there are certain parts of Los Angeles where there are doctors who don't take insurance. So it's just like, you're going to buy a bag at Ross, you're going to buy a bag at Nordstrom's. So you're going to go see a doctor in Arcadia, you're going to go see a doctor in Beverly Hills. So, you can kind of tell by the neighborhood whether, they're going to take your insurance or not take your insurance.
All right, on insurance, as always, we're going to wrap it up. I also want to acknowledge there's artwork in the back. So the way this gallery works is we usually have a featured artist or two in here. And then on the back wall, we always open the show up to faculty or students who are doing work about the same subject. Yay, let's do it for that.
I just want to thank everyone for coming. I want to especially thank our artists and Dr. Ippoliti for coming and having a conversation. This was really so helpful, and thank you to you for sharing your story as well. I wish you very, very much the best. I want to let everyone know that our next art event is going to be in March in conjunction with the Neurosciences System. And the HEAL program is also sponsoring a series of lunch and learn events, and our next one we're really excited about is actually on February 14th. Professor Viet Nguyen from University Park campus, who's a Pulitzer Prize-winning author of The Sympathizer, will be here for a talk. So we'd love to make sure we get the word out to everybody. So we're going to invite those of you who RSVP'd to sign up for the HEAL listserv. So if you get that invitation, please feel free to jump on board. And what else was I going to say? Oh, and we'll probably send you a survey as well for evaluation of our events so we can do better next time, although I think you guys kind of hit it out of the park, so thank you very much.
Thank you. Thank you. Thank you. Yes, thank you.